If you like to gamble, you probably like the Texas foster care system. We have some great foster care agencies in the state of Texas, but the quality of care is inconsistent, and if a child enters foster care in the state of Texas, their chances of getting good care really depends on the family that they're placed with. In some cases, they're in great shape. In other cases, there are challenges. This issue with the state of Texas has long been recognized by decision makers in Austin, and in 2010, an effort to look at how could we redesign the foster care system? How could we bring improvements to the quality of care overall for children in the state of Texas? And in searching for solutions, this committee identified a model that is now called Foster Care Redesign. Foster Care Redesign was launched in Region 3B in January of 2014. And the purpose of this presentation is to talk about what is Foster Care Redesign in Region 3B, what is the model that we were using, and how can this be better for kids in foster care? What is Region 3B? Let's start with our geography. Region 3B is a 7-county area that includes Tarrant, Parker, Johnson, Palo Pinto, Somerville, and Hood counties. It is a specific geographic region, and Foster Care Redesign aims to improve the quality of care in all 7 counties. It's called Redesign because it is a very different way of doing business than the state currently conducts in the world of foster care. So what's different about Foster Care Redesign? Instead of the state contracting with individual agencies, of which there are currently 44 individual contracts in that 7-county region, under the umbrella of Foster Care Redesign, there will be one contract with the state, and that contract is with a single source continuum contractor. These contracts are much more focused on performance than previous contractors. The state has clear expectations for performance that they want out of these contracts. There is also more ability for the SSCC to make decisions, have some flexibility, and there is an ability to make more local decisions, which is very important in Texas's child welfare system. The ability to look at what are our local needs and how can we work together locally to improve outcomes for children and families is part of this contract. There are greater risks to the SSCC in this contract. There are more responsibilities, there's a greater urgency to manage funding, and there's a lot of responsibility placed on the SSCC, which is a new structure in Texas. And Region 3B is the first urban implementation of this model in the state of Texas. The state has clearly planned and announced that they want to roll this model out throughout the entire state, but to do it well, they want to learn from how this may look in individual communities. So this Region 3B implementation is the first urban rollout of this contract in our state. So what are some of the details and what are some of these contract outcomes we're talking about? So one of the changes and one of the areas of risk is that the SSCC is responsible for taking custody of children within 4 hours of a removal. So once a child is removed and is in need of out-of-home foster care services, the SSCC has 4 hours to respond. Some very clear outcomes that are expected in this contract. Children are expected to be placed in their home communities. There's a lot of research to support the fact that when children stay closer to home, their outcomes improve. So this contract expects children to be placed within 50 miles of their home. It also expects siblings to be kept together. A greater percentage of siblings need to be kept together because, again, the research shows that when we keep sibling groups together, they are more likely to do better in foster care. Their chances of success are improved. We all know that one of the worst outcomes that can happen in foster care is for children to be disrupted in placement or for children to bounce around among lots of different foster homes while they're in care. This contract, the SSCC contract, has an outcome that expects no more than 2 moves in a 24-month period. We need to reduce placement disruptions. For Region 3B, the capacity that we're looking at is about 2,400 children a year, which involves about 1,400 children in care at any one point in time. So 1,400 children in care at one point in time with an average of about 2,400 children per year. And it is a no eject, no reject contract. The SSCC needs to build a network of providers, a network of service, an array of service options that can respond to the needs of any child coming into care. So when ACH looked at taking on this role of the SSCC, we did a lot of homework, we did a lot of research, and we looked at what do we think needs to happen for this model to be successful. And we really believe that for this model to be successful, we've got to change how we think about children in foster care. This idea that these are CPS's kids, this idea that these kids are wards of the court has got to go away. These are our kids. These kids belong to our community. These kids go to the same schools every other child goes to. These children go to the same doctors. These children play in the same soccer teams. These are our kids. And so it's our responsibility as a community to work together to help meet the needs of these children. That sounds simple. That doesn't happen in our current foster care system. So we said we need to remind ourselves of that vision every single day. And so the brand that we are using in Region 3B is Our Community, Our Kids. So managing this network of providers is done by a division of ACH Child and Family Services called Our Community, Our Kids, because it's essential that we remind ourselves every day that these are our kids, this is our community, and we all need to work together to give them what they deserve, and that is a safe, loving experience in foster care, the ability to heal from what brought them into care, and the ability to find a permanent family. There are a few very core values and essential functions of this network of providers that we believe are essential to success. One is a strong network of providers. Nobody can do this on their own. It's Our Community, Our Kids' job to bring together a group of providers that can work better as a team than we can independently. Right now, there's people doing some great things, but we're all working independently. The Our Community, Our Kids model brings everybody together so that we can work more efficiently, that we can work in a more coordinated fashion, and that we can leverage each other's strengths to bring services to kids and families. It's also essential that we work very closely with the department. It's not us against them, it's we. And a good relationship with the department, with DFPS, on working together as a team for these kids is essential to the success of this contract. We've got to stay very focused on outcomes, data-driven decisions. We've got to make decisions based on what our information tells us is working, what is not working, and what we need to do to help kids be successful in care. We've got to have data and to support that, and our decisions need to be made based on that data. There's a huge need for strong financial accountability in this model. Dollars are tight, they need to be used wisely, and given some of the flexibility that we have in how to spend those, strong fiscal management and good stewardship of the funding that we have is essential for the success of this project. Adaptability. We have the cool opportunity to try new things in this model. And so we've got to be willing to do that. We've got to be willing to stretch. We have to be willing to try things, and if they work, do it more. If they don't work, let's quit doing it and do something else. That's not something that we're used to in foster care and in child welfare. This approach brings us the ability to be flexible, be adaptive, be creative. We've got to engage the community. There are lots of systems our kids are involved in. As I said, some of them are in the juvenile justice system. We need to work together with our juvenile justice partners for those children. Some of our children have mental health needs, and we need to work closely with our mental health providers. Our kids go to school. Our kids go to the doctors. And we have to communicate in order for us all to be on the same page about what are we trying to accomplish for the children in our care. And one of the interesting things about managing a network is we've got to have IT systems that support the data that we need in order to make decisions. Simple things like we have to know where every child is every day. We have to know where they lived so that we can place them within 50 miles of home. We have to know what their service plan is, and we have to make sure that their needs identified in their service plan are being addressed. So good data and good IT systems to support collecting that data are essential for success in this model. Our involvement begins when a child is removed from home. A call is made to the child abuse hotline, an investigation occurs, and a worker determines that a child is not safe in their home, and a removal decision is made. Within 4 hours of that removal decision, the SSCC takes custody of the child. Within that 4 hours, we do a trauma-informed assessment, and we also use our ECAP system, which stands for Every Child a Priority, to identify the best placement for that child. Child is placed, and then within 21 days, we do a CANS assessment. This is a standardized assessment to help determine what are the service needs of the child, and then the CANS assessment just drives the plan of service that is created. And then that cycle continues on a 90-day basis. So every 90 days, we will be continuing to look at service planning to make sure that we are clear as a team about what the needs of the child are, and we're working together to meet those needs. And then the ultimate goal is that child finds a permanent family, whether that be to return home, whether that be to return to relatives or kinship placement, whether that be to be adopted, or whether that be to go into a supervised independent living setting. So that's a snapshot of the timeline. So a little bit more about what is different about this model. This is not the same way of doing business with just a different contractor. This is a different way of doing business, and this is an opportunity to bring innovation to the world of foster care. So just a couple of examples of what are some of the things that are different. There are lots of things. These are some examples of early on innovation that's happening. I mentioned in the earlier slide this ECAP system, or Every Child a Priority. Every Child Priority is a system that it was designed by a program in Kansas that has been working under a model similar to this for many years. And they were very clear that one of the first decisions that we make about children in foster care is one of the most important decisions we'll make while they're in care, and that is what family is going to be charged with the responsibility of caring for this child. That can't be a random decision. That needs to be a data-informed decision. So the ECAP system, or the Every Child a Priority system, is a database that's designed to best match children with available foster homes. So after we do an assessment of that child, we get data that, and this system is tested by the University of Kansas, and it's proven to help place children in more stable placements using this information than an experienced social worker just making a judgment about where a child should go. So we get information about the child. That information is matched with our database, which lists every foster home in our system. And it says, here is the family that is the best match for that child. They have the experience, they have an opening, they're within 50 miles of home, they have a capacity to bring the sibling group, to keep the sibling group together. This is the right home for this child. That does not currently happen in Texas. And so this data-driven support for making that decision is a new innovation that this model allowed us to bring to Texas. Another example of what's different is the ability to raise the bar for the quality of care our kids get. And one of the strategies and one of the approaches we're using to do that in Region 3B is the Quality Parenting Initiative. The Quality Parenting Initiative has shown great success in other states, Florida, California, Nebraska, at defining a common vision for what does quality foster care look like, and then recruiting, training, and supporting families that lead to that kind of quality care. So we have engaged over 300 people in our network in a conversation about what does quality foster parenting look like, and how can we as a provider network work together to achieve that vision of quality foster parenting. It's a very exciting initiative and promises to bring the right kinds of families with the right kind of support into our network to raise the bar for the quality of care kids receiving foster care. We also have several ways that the provider network is working together to shape this system. This is new. This is developing. We are learning as we go. And the only way to do that effectively and to build a strong network is to have our network involved in making decisions about what this looks like. So we do have a quality committee. We have a clinical committee. We have an information technology committee, all comprised of providers that are part of the network, and they are actively making decisions and addressing issues that come up so that we can be successful because we're working together as opposed to separately. To engage the community requires a strategy. And so we have a three-pronged approach in Region 3B to engage the community in our community, our kids. First is stakeholder planning councils. We know that individual counties and individual communities within the counties have different needs. They have different resources. They have different people involved in the children in that community. And so we have actively engaged every county in a dialogue about what can foster care redesign bring to your county. What are your needs? What are your resources? How can this help children specifically in your county? That is a dialogue that is beginning, and it's a dialogue that will be ongoing. We also know that there are going to be decisions made in Austin. There are going to be policy decisions. There's a need for advocacy for this model because it's new. And so our local leadership panel is a group of community leaders who have no interest in foster care redesign other than the fact that they care about kids and they live in this community. So they want what is right for kids in this community. These are not paid staff. These are business leaders, thought leaders in our community that are learning about this new world of foster care and will be advocating for what our kids need. These are folks that can get a phone call returned when they make it and whose opinion will be very important because they have no vested interest in this other than the fact that they care about kids in this community. And then our third prong approach is our National Expert Advisory Panel. This is not a new idea of how to do foster care. There are other states that are doing this and doing it well. There are other areas where this has brought significant improvement to the quality of care children get. There's research to support what is good for kids, what predictive analytics are out there to identify what kids are more likely to disrupt in care. What are some innovative models to keep kids out of the system? What are some innovative strategies for helping children return home more quickly? And so we've engaged a national advisory panel of experts in other states, from academia, from practice, from implementation, that can help us build on our knowledge base, help us learn from lessons that have already been learned in other areas to advise us on our implementation in Region 3B. This is a list of some of the community engagement that we've done. It's not a complete list, but just an indication that this is hard work, takes a lot of boots on the ground, and there are a lot of stakeholders that need to be engaged in understanding and supporting this effort. Just a little bit about what the contract timelines looked like for us in Region 3B. So this was a 3-year contract starting January 1st of 2014, and a 3-year contract with 2 optional years to renew. Our start date was January 1st. The legacy transfer began July 1st. The legacy transfer involves children that are already in foster care at the beginning of the contract. One thing that's very clear, one very clear directive we received from the state that we fully agreed with was that no child's placement would be disrupted because of foster care redesign. So some children that were in foster care when the contract started have been transferred into the SSCC model or into the Our Community, Our Kids model. That's purely an administrative change for the kids, but it does involve for the provider who is paying them, what the expectations are for their service. That process started on July 1st and will continue through the first quarter of 2015. New referrals began on September 1st. So beginning September 1st, the Our Community, Our Kids network began receiving all new removals into care. So what are some of the challenges that we're facing in the early implementation of this? We are about 11 months into this at the time of this presentation. And we clearly have seen some startup challenges. One is the fact that everything's new and everything's different. So we're having to figure out, what form do I fill out and who do I call and what does the policy manual say about how to do that? So anytime something's new, there is a steeper learning curve than once it becomes routine. We also are very clear that there are some capacity issues in the network. There are some things that we don't have enough of. So early on, we're seeing that there are clearly a lack of foster homes in some of our rural counties. So if we want to keep kids in their home communities, we've got some recruitment and some development of foster homes to do in some of those rural communities. We also have challenges with finding foster care for older kids with more behavioral problems and for children with primary medical needs issues. So those are clear capacity issues that are identified early on in the implementation. The neat thing about foster care redesign is we can do something about that. So when we identify a capacity issue, we can work to create that capacity. So we have already issued 2 RFIs, 2 requests for information from our provider community saying who's interested in bolstering their recruitment efforts in rural communities. And who's interested in creating therapeutic foster care for older kids with more behavioral issues. So we're 90 days into this and we're already taking approaches to increase capacity in areas where we've identified lacks of capacity. Data integrity. We talked earlier about one of the things that needs to happen to make this work is we've got to have data-driven decisions. And we're seeing that the integrity of the data everywhere is inconsistent and in some cases not good. There's missing information, there's incorrect information, there's information in 2 places that doesn't match. And so we're working very hard to, one, correct that, but also to create a culture that understands the importance of good data. We've got some folks doing this work that love kids, and they want to work with kids and families, and they are good at it, but when it comes time to being at the end of the day and putting data into the database, that's not their favorite thing to do. Understandably so, but to manage a network of this capacity, we've got to have good data. And so building a culture and a capacity for collecting good, complete, accurate data is something that we're currently working on. And then funding. We are clear that this is the initial implementation of this in an urban area. We're clear that everyone is learning as we go, and we're seeing some pretty clear gaps in how the functions of the SSCC are currently funded. That's not a secret, and the leadership at DFPS is clear about this, and they wanted to understand this, and they've commissioned an outside group to get more specific information about what does that look like, what kind of dollars are we talking about, and looking at strategies for closing that gap. So what are some of the opportunities that you've created? The first opportunity is coordinating care. 44 providers doing things independently creates huge opportunities for how can we work smarter, how can we work more effectively together than we can independently. So we're looking at some ideas for recruitment. How can we leverage the recruitment activities that everybody's doing individually into a very effective recruitment strategy that can support all of our network providers? We're looking at some training opportunities. We all do. Every provider does their own training. What are some ways that we can maybe leverage some of those training opportunities, those training resources that we have to provide high quality, easily accessible training for our provider network? The ability to try new things, to be innovative, to bring in ideas that have worked in other places is very exciting. And we've already talked about the ECAP system and the Quality Parenting Initiative is just 2 examples of some of the innovation that can be brought to improving outcomes for kids in foster care. Accountability. It's important for a provider network to work well, for us to hold each other accountable, to set clear expectations for what does quality look like, and how do we need to be responsive to the needs of kids and families? How do we need to provide good customer service? How can we make sure that we are doing a good job? And when we're not, we identify that we're not, and we do things to improve that. Leveraging resources is similar to one of the advantages of coordinating care. We can bring what we do independently together and get a bigger bang for our buck and a bigger bang for our time by working together. And then I can't understate the importance of being able to make local decisions. We have a local provider manual that describes how the SSCC works with providers, but we also have a local protocol manual that talks about how does the SSCC work with the state? How do we work with our local DFPS partners? And that has been huge. The ability to sit down and problem solve together is a very efficient and a very exciting and a very creative way to bring improvements to a network that can tend to be very bureaucratic and very slow moving. And when you add that up, we truly believe that this equates to improved outcomes for kids in foster care. Our vision is that the first placement is the best placement for children, that when we place the first home we place them in is the right home and will be the home they stay in. Our goal ultimately is to help permanency happen more quickly. We have to have a sense of urgency that we have to work hard and we need to work fast and we need to work smart for our kids and getting them into that permanent family. Everyone is clear that foster care is a temporary solution. It's a great solution, but it's a temporary solution, and we need to work towards a permanent solution as quickly as possible. We need to focus on outcomes, and we need to work together to make sure we are staying focused on how are we doing, what areas are we doing well, and what areas can we improve. We need to have the dollars track services, not behaviors. So when a child needs help, the funding needs to provide services to help them, not determine, okay, what level are you, and that's what your payment is for taking care of that child. We've got to really support our foster families, training, coordinated care, and support to give them the support network and the help they need to work with our kiddos. So why are we so excited about this? This is a challenge. This is hard, but it's an exciting opportunity. And it's an exciting opportunity for us because we've been doing this long enough to know what unbelievable potential our kids have. Yes, they've had a rough start to life because they're in the foster care system, but look at them as adults. They're resilient, they're tough, they're great members of our community, and Foster Care Redesign has the opportunity to help more of our kids be great, productive, thriving members of our community.